Magarelli, CNY Fertility, Colorado. Welcome. Hi, everybody. This is Dr. Magarelli, CNY Fertility, Colorado. Welcome to our Tuesday Live. And hello, hi. Got some waves already. We've got Yamini Vastas and Nahid and Makeup Lover B19, Kyle Livingston, Ima Baez, Rhonda Elliott, Make Baby McCree. Hello there. Kelsey Morales. Hello. Imajabes. Hi. Good to see you. And how are we doing on the Facebook Live side? We got 6 people. Say hi, folks. Making Baby McCree. Okay, there you are. Hi. Grass Pixie. Hi. Grace Doliak. Yes. Hello. Kyle Livingston. Is this a Q&A? Yes, this is a Q&A. Okay. Yeah, so I'll tell you what we're doing. Ho, Prissy Israel. This is a Q&A. Welcome, everybody. Let me just say hi to everybody. Hello from New Jersey, Maria Schwartz and Ella and Lorena. Hello, Melody91. Hi, everybody. This is Dr. Magarelli, CNY Fertility. Hey, you see this neat shirt that my front desk's mother-in-law made? It's really pretty. I'll just put it up there. Something amazing is going to happen today with a little feet inside the pineapple. It's kind of cute. It's very cute. I like it. Well, it's been a tremendous week. Gosh, good things are happening. Keisha from Missouri, hello. Monica, Carly, Amber Summers, Dayton, Ohio, hello. Angela Lenz, hi, good to see you. Oh, thank you. Really cute. I think it's really cute. I remembered water this time, folks, so I should be able to talk through the whole hour without dying here. There's Vanessa saying hi to everybody. Remember, we like you guys to be a member of the CNY Fertility member group, so please click below. You guys know how to do that on the Facebook side. Maybe, Vanessa, you could throw some stuff over on the Instagram side. Hello from Kansas. Okay, so why don't I do this? Thank you. It's a kind of cool shirt. It's a very cool shirt. It's got little baby feet inside the pineapple, which I think is very cute. Okay, so it's 4:01, and since this is a Q&A, I'm going to try to answer the questions. Hello, Jean. Just flew into Colorado today, but worried my stomach is very bloated. Okay, so ovarian hyperstimulation. Ovarian hyperstimulation is basically a syndrome associated with lots of eggs. Unfortunately, the estrogen produced by those eggs from the ovaries can sometimes cause a disruption in the fluid management. So that bloating that you feel usually goes away by itself. The way we manage it is high protein acupuncture. We manage it with electrolytes and rest. Sometimes you need pain medicine. Sometimes you need nausea medicines. Mainly is rest. Suggestions on preparing for a third frozen transfer, whether it's first, second, or third. Make sure you follow the recommendations in the family building guide. Make sure you're doing acupuncture. I do like Sterol Vital, which is a growth hormone secretagogue that you can use to help build your own body's growth hormone. You can ask for growth hormone in addition. Avoid alcohol, tobacco, drugs. Those are the kinds of things you can do for any frozen embryo transfer cycle. And, depending on whether the embryos are been genetically tested or not, you may even want to have an endometrial receptivity assay, although that's controversial. If you get a hysteroscopy, do you need a saline sonogram or do you achieve the same thing? Kemi, I think you could do just as well with a diagnostic hysteroscopy. I don't think you need both. But you can do both, and some people feel both are better. Do you take Omnitrobe and Sterol Vital after retrieval? Yes, for your preparations for your transfer. What beta numbers do you like to see for the first beta when taking HCG boosters? I don't have that number, and it's just clouded, but it'll go up if you're pregnant, believe me. What prenatals would you suggest? Anything that says prenatal, it has to meet federal guidelines. We certainly sell some, but there are many on the open market. Is decaf coffee or avoiding caffeine altogether better? No, you can do decaf coffee. That's fine. How far into pregnancy should I continue acupuncture? Actually, people doing that to birth. How do you decide what stim works best for someone with PCOS, and how to decide what protocol to use? That's what is that? 16 years of experience. How often do you need saline-infused sonograms? I had a polyp removed a year ago. You should have something within the year. What size should a follicle be to be inseminated? I like it at around 20 millimeters mean diameter. I have a consult next week. How soon after my consult can I start the IVF cycle? Probably about 2 months. Do you know approximately how long the wait list is for a donor embryo through CNY? I do not. What do you think about duostim, Rosanna? I do duostim now on everybody that has low ovarian reserve and who are willing to do it. Remember that you don't get a fresh transfer with duostim. I have a simple cyst. How do you proceed with IVF? Do you aspirate on day 2 before we start the sim? Ramesh, that is certainly an option. Mariam K, I have something, not sure what it's called, but not PCOS. I got good number of eggs, but not good quality. What is it called? I had stage 4 endometriosis. I don't know what it's called. To delay a period after an ERA, do you recommend continue PIO in addition to the suppositories and estrogens? Why would you delay the period? I don't understand. I had to cancel a cycle because of a GI bleed. Will I be able to go on Lovenox, baby aspirin, and prednisone again? Not likely. I had one ovary and been trying 12 years with a loss last year. I really want to transfer 2. Is that an option? At a loss. Well, I think you asked me this last week. It depends. You have to talk to the doctor. Seems like my ovarian reserve is fine. Can I do a duostim? I wouldn't. Angela, is there such thing as too much human growth hormone in a protocol? Not likely. Can you have an FET transfer with a 45 millimeter ovarian cyst, which has been there for over 5 years? You can, but I sure would either aspirate it or do surgery. 2 weeks of SCH on bed rest. You guys with these initials. No more bleeding. Oh, subchorionic hemorrhage and hasn't grown. Any advice? Help? Still on PIO and lots of fluid. Stop baby aspirin and Lovenox. Well, I would go to acupuncture. They're very good at preventing miscarriages. I have high LH. Oh, went by too fast. How long after hysteroscopy? 4 to 6 weeks. I had pituitary surgery, and after that, I don't have my periods back. Is IUI with injectables right for me? Yes. What would you recommend for continued too thick of endometrial lining at baseline? You may have to get a DNC, Audrey. Is it better to do a month of birth control before priming and stimming to start IVF? It's not better, no. When will Atlanta or Sarasota office be available for transfer? No idea. After 2 failed transfers, 1 chemical, would you suggest to transfer 2 next transfer? I guess that's an option. Talk to your doctor. What do you suggest for my next steps after 4 failed transfers and 6 total embryos? Did a lot of things. Acupuncture, serovital, growth hormone, avoid alcohol, tobacco, drugs. That's what I would recommend. I love your shirt. Hope you're having a wonderful day. Thank you. How long do I have to take progesterone and estrogen before I see my period? Don't know. How long have you been on it? Why are you taking progesterone and estrogen for your period? It's like it should be a 28-day cycle. What testing do you recommend for a 22-year-old with 2 FETs that ended in a chemical pregnancy? Well, there's no protocol. Hilo Scooby. Hello, it was nice meeting you in Colorado. Even though we couldn't get our transfer, we're not ready to give up yet. Don't give up. What should HCG be after an FET for a positive pregnancy test? Whatever the lab says. Each lab is different. I didn't get my cycle this weekend. CMI ordered baseline labs and ultrasound this Thursday. If I start IVF meds Thursday, what would you anticipate egg retrieval? It's always, it's about 14 days after you start. When should HGH be? Oh gosh. When should HGH be started? Growth hormone. Yeah, it's about 30 days before is good. If you could do it 60 days before, it's even better. That's growth hormone. How long do you stim and luteal phase for duostim? It's about the same length, about 14 days total. How do I go about syncing my and my partner's cycles with birth control when doing fresh reciprocal IVF? We already have the birth control, just can't find any info on how to start doing this. Fresh reciprocal, I think that's a tough very tough to coordinate. Yeah, it's not a simple answer, Megan. You should be talked to a doctor, and will basically come up with a protocol for both of you. So she's doing fresh. Well, you're going to be on you should be on estrogen, and then the person who's receiving the embryo will start their progesterone at the time of trigger usually. Do people use Omnitrobe for transfer? Yep, they do. My first euploid failed. Any suggestions? Only one normal? Yes, an ERA. Make sure your timing is right. Acupuncture, low carb eating, and all the wonderful vitamins. What should lining be? At least 6 millimeters or 7 millimeters trilamina. Optimally 10 millimeters trilamina. Okay. Where do hydrosalpinx go when it disappears? They don't disappear. They're either surgically removed. They don't disappear. Now, they may not be filled with fluid. I'm not sure they disappear. You performed my embryo transfer on 4/7 and unfortunately ended in a chemical, which is my second chemical. I spoke with Grace. She recommended a natural FET with a full immune protocol. Would you agree my embryos are PG tested? Well, Brittany, I would make sure you've done an ERA also. What helps lining a week after baseline was only about 5.9? Wondering if something I can do next cycle. Well, you could ask them if they can change to injectable estrogen. Sometimes that can help. Estradiol valerate. Is LDN taken during priming or FET or retrieval? I think it's mainly used to help with inflammation for transfers. I'm low AMH and have lupus. Do you recommend DHEA? I actually, a lot of controversy on the use of DHEA, whether it helps or not. What supplements do you recommend for PCOS? Never been pregnant prior to IVF. Well, Avasitol is one. A low-carb diet is another. And then look on our family building guide, and you'll see lots and lots of recommendations. How long can you freeze sperm? People have done it for 20, 30 years. Is there a wait list for new patients? Yeah, kind of. I think our next opening is probably July. How quickly after a consult do we get a medication list? Within about 2 months. If my endometrial lining is 9.9, will I need ovarian stimulation? My endometrial lining. Not sure what your question is. Recommendations for folks with diabetes. Diabetes recommendations for PCOS. I'm not sure what that means. My husband has a low morphology. Will that interfere with successful IVF? No, not really. You keep skipping me, Nyasha. I think I don't see your question, Nyasha. I don't know what to tell you. What is your question, Nyasha? It's hard for me to see everybody, my folks. I had my first consultation. Any advice on what to ask in terms of male factor? Well, it's always egg, sperm, uterus, fallopian tubes. Your AMH is the eggs. Your semen analysis is the sperm. The HSG is the fallopian tube, and the hysteroscopy is the uterus. Your hormones, you want to have them balanced: thyroid, pituitary, prolactin. The male hormones, you want to make sure there's no infectious diseases. You want to make sure there's no structural problems. You want to ask what the types of options do I have, so you can figure out your options, comparing one to the other. I got my IUI a week ago and had to go to the emergency for a headache. Blood tests and urine samples both came back positive. Is it too soon? I pray it sticks. Well, I don't understand your question, Nyasha. Just get another pregnancy test. Ricky, I am a diabetic not able to get pregnant with PCOS. Is there any medication recommended other than metformin to get ovaries working? Metformin doesn't get the ovaries working. It reduces insulin resistance. The things to get the ovary working are fertility medicines. So gonadotropins or instigators like letrozole or clomiphene. Do you recommend multiple duo-stim cycles in succession? How soon can you transfer after your last duo-stim? Probably about 17 days. Because I continue to have a thick lining, would you recommend less estradiol? During my ERA cycle, I was taking 3 estradiol a day. Well, the problem is the moment you change well, yes. The answer is yes if it's too thick. My right ovary is that, and my left is that. Endo is that with fibroids. Will I need to get medicine for ovarian stimulation? Are you trying to get a transfer? Key belly das bella das stylus? I'm not sure what you're asking. Why do they say my age at 39 it would be more difficult to get pregnant? I'm healthy, average woman. Doesn't sound so promising. Reproductively, you're considered advanced maternal age, any age over 35, and that has to do with the available eggs. So a woman loses 1,000 eggs a month from age 13 to age 35, and then loses about 10,000 eggs every month after that until they run out. And so once a woman is 40, believe it or not, they consider that normal for menopause. So menopause simply means you're running out, or you ran out of eggs. So that's what they're saying. It's not saying that you can't get pregnant. It's just saying that it's a little more difficult. That's what they're saying. So for transfer, you had a question for transfer. Yes, for transfer. Yeah, that's as long as your lining is good and your timing is right. But again, your doctor has to create a protocol for you. It's not a yes/no answer. Are there any supplements that really help in your experience based on evidence-based to improve egg quality? This is Samya. The main thing that has been shown to help is growth hormone. I think the antioxidants certainly help. You have to have folic acid, vitamin D3. These are critical for health. Those are the criticals. Well, I have to say is I just heard of this clinic the other day, and this was an answer to prayers. Still waiting to hear back on the consult. Well, it's our pleasure. What is the possibility to get pregnant with embryos that are from eggs retrieved at 42? About 5 to 10% chance to get pregnant. If they're chromosomally normal, of course, then 25 to 30. Is it better to regulate or lower your A1C before time to conception, time to conceive? Always regulate your hemoglobin A1C. Which facility and what doctor? I don't know what that means. My FSH is 13, my AMH is 1.2, and am I at risk for diminished ovarian reserve? Yes. I'm 38 and had an IUI for my last pregnancy. I had my tubes tied 8 years ago. My partner is 41. Should we do IVF? Yes. I have a day 3 morula. Would you recommend transferring the embryo or another day 3? I don't know. I think either of them can make a baby. What is the possibility to get pregnant with embryos that are from eggs retrieved at 42? Oh, you already answered that. Yeah, I beat the odds. I don't know what the question is. Alicia, my donor is getting her eggs retrieved May 6th. How long after that do I get to transfer? Usually the next month. Looks like you will be my provider doing the transfer. Yay! Jean Alvarado, any tips on stopping the bruising on my stomach from? Nope, no tips on that. Non-responsive to the highest dose of letrozole and Clomid. Then you have to move on, Nicole, to injectable fertility medicines. Hey, this is Shanika. I just joined and not sure whether my question has been answered. I'm 36. And does the egg quality or the amount of egg reduce? I have done the egg retrieval, but only 2 mature eggs. I'm not sure what the question is, Shanika. Do I need both Omnitrope and Serovital? Will Serovital do the trick by itself? Well, I think growth hormone will do the trick by itself, but I like to use the Serovital because it allows your body's natural hormones. Can you elaborate on injectable fertility medicine? Sure. They're called gonadotropins. They're used for IUIs and for IVF. They're just a type of fertility medicine that's an injectable form, and it represents the hormones from the brain. 35-year-old with an AMH of 0.8. Is IVF an option? Yes. If we are not planning on testing, would fresh or frozen be recommended? Fresh. You said a month after my donor retrieves her eggs, I will transfer even though I don't get periods. How would I know you don't get periods, Alyssa? And it shouldn't have anything to do with your periods, so I'm not quite sure of the questions. Should I stay on Serovital through pregnancy? You certainly may. What preparations could I do to have a successful IVF treatment? The main thing is read the Family Building Guide, which is free on our website. Hani Ali, I'm 30 years old, and I did a test for my AMH, says 2. Is that a good number? Yes. What got you into being an IVF doctor? Well, basically the love of reproduction and reproductive medicine and hormones, and I love science. I love investigating things. Yeah. Okay, fun question. Do you have any idea how many babies you have helped make in your long career? Over 5,000. How long is it safe to use growth hormone? How many days per month and how many months in a row? I'd say 2 or 3 months. Are antioxidants, is it okay to stay on them for months? Yep. I'm 28, AMH is 14, PCOS, but is that a good number? Yeah, that's a great number. Having seen a patient develop a leading follicle while taking Omnitrobe, my doctor doesn't want me on it. Have you seen patients develop a leading follicle while taking? Yeah, I'm not quite sure how to answer that. Yes, of course, we want them to grow follicles. How long after freezing eggs can you store them for? Well, some people are looking at 25 years. Is it from anything other than Lovenox? Buy smaller syringes, ice before and after, don't print skin? Oh, that's Maria answering the question about the bruises. How can you use to boost your ovulation and raise your LH, estrogen, and progesterone levels? You don't want to do that. You just want to raise you want to ovulate. So basically letrozole, clomiphene, fertility medicines. All righty. Thanks for all I do. You're very welcome. My pleasure. How can you boost your ovulation and raise your... Okay, I just heard that a second ago. You got your answer, Sally. How many eggs can be inserted back in during IVF? Is 3 possible? Nope. I had a follow-up appointment with Amy Jenkinson's after my ER, which produced abnormal PGTS. I forgot to ask if I should change my protocol or keep it the same. Is there any way to get that answer without having another appointment? She's awesome, by the way. No, you need to talk to a doctor, Harpnob, or you can portal, and the nurses can contact the doctor and see. See y'all in 2 weeks for another FET. Love it. Sally, my pleasure. Laura's journey to be. How many eggs? Oh, we already said that. All right. How does a CM grade mean for day 3 embryo? I don't know what a CM means. Sorry. What should I expect to see at a 5-week ultrasound? Oh, just a sac. If you're pregnant, a little gestational sac. That's about it. In the right place, which is the uterus. Do Serovital and Omnitrobe accomplish the same thing? Sort of. One is exogenous growth hormone. One stimulates endogenous growth hormone. Male factor vitamins, just go to our family building guide. You can look there. Do you believe each embryo should be given a chance? Would you be open to transferring 3 abnormal embryos? I wouldn't be open to transferring 3 of any embryo. I don't think that's a good plan. But if it's your embryo, you certainly may transfer your embryo. The Atlanta clinic doesn't do transfers, do they? Nope. It's just a clinic that monitors. Yep. What is the best lifestyle change for PCOS and endometriosis? Very different. But reducing carbohydrates is probably your best. Do birth control pills affect your AMH level? They do not. Male factor vitamins, you can go to the family building guide. There's a list there. There's you want to make sure it has antioxidants, vitamin D3, folic acid, zinc, vitamin C, CoQ10, arginine. Yep. You don't think 43-year-olds should transfer 3 untested embryos? No, I do not think that. Do you have any recommendations for somebody with premature ovarian failure? Well, usually if you have true failure, it means you don't have eggs. Therefore, if you don't have eggs, then you need donor egg. If you're asking are there things that might be done, one of the things that might be done is growth hormone. PRP of the ovary is certainly something we're beginning to investigate more heavily. So those are definitely options. What size eggs is considered mature? The follicle size, I think, is what you're asking. It's 18 to 22. And if you listen to my lecture last week, go back through the history on Facebook, YouTube. What if they have a lot of untested embryos, still one at a time? No, Lisa. I think 2 is reasonable, but it's never really reasonable to put 3 embryos in if you're 43, because it doesn't necessarily give you an advantage. All it does is put you at a high risk of higher order pregnancies. So 2 is not unreasonable. Because of my premature ovarian failure, I am using donor eggs. How do I prepare for transfer? Well, I think you answered your own question there. Recommendations. Well, you have a whole protocol that the doctors are going to give you to prepare. Does hysteroscopy increase the chance of getting pregnant with PCOS? No. Thoughts on recurrent pregnancy? Just lost 5th baby after doing IVF with PG. Blighted ovum. Should not have had a chromosomal issue. Well, Lauren, that's a big question. You should be worked up for recurrent pregnancy loss, which is the antiphospholipid antibody syndrome. You should definitely see if there's endometriosis on board, adenomyosis. You should see if there's endometritis. You should make sure, nutritionally sound, make sure your hemoglobin A1C is normal. If you don't have any other risk factors, at some point you may have to discuss looking at a gestational carrier. Thoughts on recurrent miscarriage loss? Oh, we already went through there. What exactly does the ACG wash do? Does it increase chances of success, Carissa? Well, the idea behind that is that it upregulates the receptors. So that's the idea about that. What is your opinion about embryo banking at 42? I think it's always a good idea before you put the embryos in. What increases your chances of getting pregnant? Avoiding alcohol, tobacco, drugs, a good diet, meditation, keeping yourself fit, avoiding toxins like alcohol, making sure you're taking a good vitamin, acupuncture, stress regulation. Should we not have intercourse prior to IVF to keep sperm count high? Well, if you're going to get a good sample of sperm, you need 3 days of abstinence. What is it called, acronym-wise, when they check for the sex of the embryo? It's called IVF with PGTA for family balancing or for sex selection. PGTA. How many months after receiving ovarian PRP will it last? Not sure. I don't think they know that. I think probably 1 to 2 months is the effect. What would you recommend to patients that don't ovulate and have and are regular? Well, Clomid would be great. Or I'm sorry, Letrozole would be better. For someone who has PCOS, would you recommend mini IVF? The terminology is wrong. Would I recommend low dose medications? Yes, not mini. Well, mini is a low dose medication, so I guess that's a way of thinking about it. What are the chances of every embryo being boys? I want to do gender selection, but told all my embryos could be boy. Apparently 100% for you, my dear. It's always 50-50, though. Let's see. 39 years old, diminished ovarian reserve, on 22, 25, 225. What would be a best next protocol? Thanks a bunch. Well, I would do the Duo Stim protocol. Amanda, hi Amanda. Would you recommend hysteroscopy with retrieval after one failed fresh transfer of a day 3 embryo? Well, if it's been no, not necessarily. I think that's overkill. Yeah, I think that's overkill. After a failed FET chemical pregnancy, recommends saline and not hysteroscopy. What would be better in your opinion? Well, a diagnostic hysteroscopy is the gold standard best way of looking at the uterine lining. How long after OHSS would you start prep for? It's usually about a month. Ellen Joe, I think you asked us already about, no, maybe not. DHEA, is it recommended? Some people do, some people don't. I'm on the fence with that. I think testing people's androgen levels are a good idea, depending on the age. Can sex of a baby be chosen? Yes, if you're doing IVF with chromosomal testing, yes. But only if if you make a boy and a girl. I once had someone get mad at me because they didn't get a girl, and I said we can't make girls, but we can pick out the embryos that are girls. So it's just what it is. Do you see more boys or more girls with donor IVF? I think it's about the same. If eliminating veggies are per Dr. Kills, how do you replenish all the nutrients that we get from veggies? You should ask him. I don't eliminate veggies. That's not solely my approach, but I think a good greens multivitamin can get you a lot of those nutrients. I asked because CMY asked me to do a genetic test, but all I want is the PGTA you explained. No. The person who said that, Jennifer. No, Jennifer. What they're talking about gene testing versus chromosome testing. I'm talking about chromosome testing. Would I have to prep for 2 months prior to my IVF cycle? I've done no. Ali, a lady, 33, have high E2 with regular but scanty amounts of blood in the period. Her AMH is 3.4. How can she conceive, or kind of treatment she would opt for? High E2 with regular but scanty amount of blood. Well, IUI, IVF, I guess. Does the administration of more than 10 milligrams of prednisone for FET pose danger to the fetal organogenesis? Well, I don't know why anyone is recommending more than that. I don't know the answer to that. Does the how might be the transfer prep for post Asherman's be? Well, it would be a high dose estrogen for sure. PRP would be a really good thing for that. PRP washes. Would like to have twins. Is it possible with IVF? Is that something that's done in the lab or in the body? No, we don't try to make IVF twins. We try to do one baby at a time. If your body splits, if the embryo splits, then you can get identical twins. So that's one way. Would I still need a prenatal vitamin if I'm already on bariatric vitamin regimens? Absolutely. Make us lover B19. Yes, because very different. I should say there would be more medications that you would need, more vitamins that you would need, for sure. Well, everybody went quiet, so I think I'll have some water. PGTA for genetic testing is it does cause extra on top of the cost of IVF. Would you recommend a 47-year-old with high ovarian reserve try to use her own eggs, or just go straight to donor? Go straight to donor. Rebecca, during my consult, the nurse practitioner recommended high dose med protocol. Listening to you guys, it seems that lower dose is recommended. No, don't agree. I don't believe lower dose is recommended. That's certainly not something that I believe. What is your recommended dose of prednisone for FET? I tend to not order it as a generic. If you have a history of some immune protocol problem, then yes, but I would have to look up. I don't keep that in my head. Do intralipids IVS work good? Do you suggest it in the wash? I do think it's a low cost possible additive to a cycle. I don't think you're required to do them. I think it's helpful. It may be helpful. I'm not sure it's helpful. If you don't get a cycle, would you recommend inducing one? Yes, absolutely. PGA testing is hormones and is chromosomes and gender, and PGTM is the genes. That is correct. Is it okay to transfer 2 embryos after MMC age 34? MMC. miscarriage. What is MM? Multiple miscarriages. God. Well, again, this is the funny thing. I find it funny. Putting in more embryos, I don't think is going to increase it may increase your pregnancy chance, but also it can increase your miscarriage rate too. So rental creams interfere with success. Do dental, I don't know what that is. Sorry. Do you think skipping IVIG will make a huge difference, Roxana? You have to talk to your doctor. That's not it's a menu item, and if you want it on the menu, you could do it, but there must be a reason someone recommended it, or you've read about it. I think it's controversial. My wife was prescribed 40 milligrams of prednisone with her immune protocol. Is that too much? Again, the immune protocols are not something that those were developed by Dr. Kiltz, so there may be reasoning for that, and I would contact him. I'm taking below supplements to prepare for transfer. Is it okay to take them? Do you believe chromosome testing will be the best option for a 42-year-old to detect abnormalities? Okay, that's two different questions. Do people today still believe that PGTA is useful after 40 and below 35? Not so much. Is it useful for detecting chromosomal abnormalities? Absolutely. Does PGTA test for Downs? Yes. I don't know what Edwards syndrome is. If it's a chromosomal issue, the answer is yes. Your take on fresh or frozen? Why do you recommend and why? I actually recommend both. Yeah, for whatever the circumstances. If you have a very high estrogen level, then you want to do frozen. If you have PCOS, you tend to want to do frozen. If you have low ovarian reserve, you tend to want to do fresh. Oh, so if anything that's a chromosomal abnormality can be seen on the PGTA. What other supplements should you take for prep for transfer? They're in our family building guide. So go to the CNY Fertility website, resource page, and they're all listed there. Oh, do retinol creams interfere with pregnancy success rates? Do not ever take retinol for any pregnancies for any reason, specifically because of its teratogenicity. You do not want to take retinol products anyway, anywhere, any close to when you're trying to get pregnant. After a laparoscopy, how long would you recommend to do an FET transfer? 4 to 6 weeks of healing, and then do the next cycle. My pleasure. Had multiple failed cycles on letrozole and Clomid, finally produced a mature follicle, but it didn't mature enough until cycle day 23. Does maturing late cause a lower A quality? No, it actually doesn't. What's your opinion about doing mini IVF versus regular IVF for women over 43? Yeah, there's lots of studies about it. The mini is reasonable for women over 43 because they tend to have low ovarian reserve. And really, the mini, that's what it's kind of for. I have diminished ovarian reserve, but also have type 1 diabetes. Do you think fresh or frozen? Fresh. Fresh. Okay. Good question. So I'm Dr. Magarelli, CNY Fertility, Colorado. It's my happy Tuesday. Beautiful, sunny blue skies here in Colorado Springs. Weather, let's see, it's about 76. It's kind of amazing. Doesn't know whether it's winter or summer or spring, though. It's kind of drifting all over the place. You're so welcome. All righty. Welcome, everybody. Low in AMH, supplements you prefer? Well, Sterol Vital. Acupuncture is a thing you can do. Growth hormone is a thing you can do. It's not a supplement. Antioxidants, of course. Mitochondrial boosters, they exist. The B complexes would be useful. Look at our family building guide. I'm 39 and we'll be doing a frozen transfer next. I want to transfer 2. Well, it depends. Have you done a transfer before? Is frozen always preferred over fresh for mild PCOS? No, not for mild. My tubes are blocked. Would CMY go through my abdomen to retrieve my eggs? No, we never, Jennifer, go through your fallopian tubes to retrieve the eggs. We go directly from the vagina to the ovaries. The ovaries sit right next to the vagina, and the uterus is up here, tubes are up here, but the ovaries, here's the vagina, here's the ovary, and all you have to do is place a needle through the wall of the ovary to the wall of the vagina to the ovary. If I have intermittent PCOS, would you recommend frozen transfer? I was planning to do a fresh since traveling from Minnesota. There's no such thing as intermittent PCOS. If you have PCOS, it depends on how you respond. If you don't have a great response or you have low estrogen, then you could do a fresh. Lacey, I did genetic testing. I have 3 normal embryos. Financially, I will have 1 shot. Lacey, okay. Do you ever transfer 2 at a time? See, everybody, okay. The American Society for Reproductive Medicine, which is the organization that basically establishes IVF in this country and regulates it, recommends 1 embryo untested in most cases. And in testing, for sure, it recommends 1 embryo. Why? Because the reason why we don't have insurance coverage for IVF is because we transferred too many and made too many multiples, and then the insurance companies got off the hook for they basically got off the hook for covering infertility. So we've now worked very hard convincing the insurance companies, and now more and more state governments are covering infertility because we convinced them we weren't going to make twins, triplets, quadruplets, octuplets. And everybody thinks putting more embryos in is going to get you a better chance of getting pregnant. Well, the way embryogenesis is, there's a slight increase in pregnancy, but there's a huge increase in multiple pregnancies. And that's the thing that's going to keep us all from getting coverage for IVF. So everybody wants more than 1. Everybody wants twins. Everybody thinks it's better. But in reality, it puts us at risk. So we try not to. Put more than 1 embryo in. Alrighty, Nivea. Usually I have my cycle day only till 4 days. I started stims yesterday and I'm still bleeding. Is that common? Yes. I had a miscarriage end of February. I'm sorry, and still haven't gotten my cycle back. I should do it if I follow Rebecca tomorrow. What should I ask? Well, what you want to do is look at the lining, make sure it's okay. And if it's thin, then you can continue. Does estrogen drop enough for fresh transfer if I am 3,000? No, it does not drop, Mrs. V. Eugenia. You use that 3,000 as the risk factor. Rose. I had an unexplained miscarriage of twins, naturally got pregnant, and 2 full-term pregnancies prior to that. Now going to try IVF due to male factor. Not sure if I need to do a normal or a mini. I don't know how old you are, Rose, and I don't know what your AMH is. What are your thoughts on an FSH only stim for PCOS using only gonal-F and no Menopur? It'll work. Lindsay, finally produced a mature follicle. This cycle on Clomid, it didn't mature until cycle. Okay. You asked that question before. It does not affect egg quality. This is Lindsay Smoot. What would be the best option for gender selection? We're hoping for a girl since we already have 2 boys, but don't want any more than 3, and my boyfriend has already had 4. Okay. No, IVF with PGTA. You're 35, Rose. Yeah, I don't know what your question was, Rose. I forgot. How soon after I can assume intercourse at the retrieval and transplants? Give it 3 to 5 days. At what age and at what AMH is minimal recommended? Over 35 with low ovarian reserve, less than 1. Is a genetic test worth it? Yep. 35-year-old and I don't know my AMH. And what was your question though? What to do? What do you like estrogen levels to be at a time of transfer? At least over 100, maybe 250, 150. It's in that range is fine. Unexplained infertility, 3 failed transfers, I'm assuming. All normal labs. Advice for a successful egg retrieval. 3 failed PT. Don't know what PT is. I think IVF, and it's about a 25% with basic IVF and about 40% with IVF with chromosomal testing. What are options for having gender selection? IVF with PGTA for gender selection. PGT. Thank you. There you go. There's your option. Okay. Is there a normal time frame to do a retrieval transfer after having a laparoscopy? Yeah, 4 to 6 weeks. Nicolette, AMH is about 1.8. FSA starting out as soon. I'm 37 expectations. About a 15% chance with your own eggs of success. Rose Doyen, normal. Okay. I have unexplained. Do I need to do a normal? Oh, yeah. Okay. Thank you. Yeah, do a standard. Thank you, Maria. Do a standard cycle, Rose. You don't have low ovarian reserve, and I think you'll be fine. But again, get your AMH. How much should it cost for the whole procedure? Look on our website. Can a mature follicle be too large the day before ovulation? It can. I'm still working on my low TSH levels. I have a hot nodule. Why can't I start IVF? Well, what I would do, Crazy Liv, is I would get the embryos made and then get your thyroid under control, then do the transfer. Thoughts on switching to Granix from Neupogen to save money? Don't know either of them, sorry. Difference between a day 3 transfer versus day 5, well, think of it as the difference between a caterpillar and a butterfly. So on day 3, you have cells that are identical to each other that could make a baby. And on day 5, you have a blastocyst where some of the cells are the baby and some of the cells are the placenta. So it's more differentiated, therefore it has a higher potential of sticking. Ellen Joe, 40 years old and a 2.8 AMH. So I would do standard IVF, Ellen Joe. Heather Brooke Smith, does the removal of polyps and endometriosis significantly improve IVF success? Absolutely. What transfer day do you recommend? Based on your age and based on your history and based on the amount that you have. Midway Labs for all natural transfer shows progesterone 36 and estrogen 89 at transfer. They were 32 of progesterone and 69 estrogen. That's looking good. Day 3 or day 5? Again, it just depends. AFC normal over 10. I think that's a good AFC, although I don't use that number. Why do you recommend fresh transfer for low AMH? I want to do the trio scans first. Don't know what trio scans are. I need a hysteroscopy for polyps. At a septum, my lining is always thin. I have to wait until next cycle on cycle day 10? Yes. Fresh or frozen transfer, 42 years old, AMH of 2.6. Gosh, if you can grow to a blastocyst, please do. Nicolette, how you said 50% chance for me. Is that for egg retrieval or for sticking? Now, 15% chance of you getting a pregnancy test. What is Provera used for? Well, Provera is a substitute for progesterone. I don't like it. I like natural progesterone, prometrium, progesterone, suppositories. But Provera is medroxyprogesterone acetate, and I don't like it. It's a chemical. It doesn't have a good rap. People who are joining, hi. Thank you for joining. But I just want to tell you, I only have about 5 minutes, 6 minutes left in this conversation. We start at 4 p.m. I'm Dr. Magarelli, CNY Fertility, Colorado. So it's Tuesdays, 4 p.m. Mountain Time. But I'm glad you're here. Hello. Thank you for waiting. How much higher a chance will donor eggs? Well, they're about 70% donor eggs, approximately. Would it be better to do a fresh or frozen transfer for male factor? Neither. My husband, nothing. Yeah, no, that has nothing to do with fresh or frozen is the male factor. What should progesterone level be at the time of transfer? At the time of transfer, yes, over 10, but we like it over 20. 30 years old, no fertility issue, had tubes removed. Would natural be possible? Nope. You have to do IVF. All righty. I have low AMH. What is your recommendation? Mini IVF? Yes. With fresh transfer? Yes. Hello, beautiful name. Jimmy Z Zepp, I had a great first retrieval, 4 blasts, and then next month had a bad second one, no blast. How long should I wait to try? Again, do it as soon as possible. How important is trilometal lining for FETs? Very important. So how could Jarrett and Courtney have exactly the same questions at exactly the same time? Are you guys sitting in the same room? Natural Ivy is what I meant to say. Sorry. Is there a grant going on this month? There's a grant going on every month. What do you recommend? Mini IVF or regular IVF for women who's over 43 with an AMH of 0.5? Mini? What would you prescribe to induce a period for PCOS patients? Is injectable IVF? Great minds think alike, Courtney and Jared. 35-year-old, 0.85 AMH, mini. Well, I always do a first in that age group. I'll do a normal cycle first, and then I will consider doing a mini if it doesn't work. What would be your clinical reasoning for using low-dose HCG instead of Menopur, not just because it's cheaper? None. Since you're limiting my thinking, I have to say I have no thoughts, because the reason is financial. Had a retrieval last Thursday, and thank God 8 of 15 eggs fertilized. I'm 41. Should I transfer 2? I had 3 failed fresh. Yes. So any tubal ligation you have to do IVF to get pregnant? Yes. Reasons for Zymot? Can't find one. Do you always prescribe birth control pills before using stimulation medications? No. Could you explain what it's the protocol when you said mini IVF? No, that's just too complicated. It's just a dosing with letrozole, specific types of HCG. It's you can see it on websites what the mini IVF is. It's just less medicine, so it saves you money. Is the data behind the ERA? Sorry, it's not a sentence. Oh, is there data behind the ERA? My pleasure. Yeah, there's data, but unfortunately, it's not conclusive. Actually, it's getting less conclusive. A lot of times what's happening is things are getting onto the market before they've actually gone through really good trials. What's the difference between a TESA and a TESA? There's none. Maybe British versus English. Both of them are testicular extraction of sperm. Some people call it TESA. I do. Some people call it TESA. It's the same. 36-year-old mild PCOS 3.2, fresh or frozen? Probably frozen. Data for Receptiva. It's good for monitoring inflammation. However, it doesn't say much. Is there a wait list for IVF? Yes. Well, not really. It takes 3 months. For low ovarian reserve, which one do you recommend? Mini? Yes. Conclusive data for scratch? Nope, there is none. I have started my process for IUI. Excited. I currently have PCOS and breast cancer at 31. What do you recommend for vitamins? Beautiful Renee. Go to our family building guide on the CNY Fertility website. If my local office can't perform ERA, do you perform it? Yes. And is there a separate date from transfer? Absolutely. It's the month before. What do you recommend to decrease inflammation? Well, diet one. That's probably your number one. You could do acupuncture, but I'd say diet mostly. What is AMH? Anti-Mullerian hormone. It's a laboratory test that detects a compound called anti-Mullerian hormone, which is secreted by follicles that are active. So it gives you a surrogate for the ovarian reserve. Has an ectopic pregnancy. What are your chances of ectopic with IVF with a history of ectopics? It's very low, probably less than 15%. How do you choose transfer protocol for first transfer? Never been pregnant? There really isn't. It's just estrogen plus progesterone. Recommendations after embryo transfer, acupuncture, mainly. Can Omnitrobe cause a bigger leading follicle? Nope. Are there any other medications that are really recommended to help with egg quality? Well, the vitamins, growth hormones, Serovital, acupuncture. Just had a chemical pregnancy. Doctor did protocol 3 with HCG wash and intralipids. Doctor kills diet. I have endometriosis. Do you recommend move to protocol 4? Nope. I'm not sure the reason why you had a miscarriage, but it's not the protocol. Yeah, you're very well. Yeah, you guys asked a lot of questions. Do you guys work with people who have balanced translocations? Absolutely. That's the best use, one of the better uses for PGTA. How do the HCG boosters help implantation for a frozen embryo transfer? Because it substitutes for a corpus luteum. How to help implantation age 38, acupuncture, serovital, growth hormone, PRP. What is your preferred medication method for endometriosis when planning for a retrieval? Don't know. Can I maintain normal exercise routine leading up to IVF, including heavy cardio? Not 8 or 9. Well, on day 8 of the stim or 7 of the stim, your ovaries are so big, you probably don't want to do that because it's going to hurt. Do you recommend subserosal fibroids be removed prior to IVF? Subserosal? Absolutely not. Submucosal? Yes. Is Intradilibid and HCG wash recommended for fresh transfer? Yes. Alrighty. You know what? Intralipids are curious. They're mainly for providing, reducing inflammation, because fat in your diet is a great thing to reduce inflammation. Sugar in your diet is a great thing to cause inflammation. So reducing sugars is a good thing. If you have no eggs fertilized after transfer, do you get another chance for the amount that was paid for the first cycle? Again, Victoria, I don't do the financial stuff on this webinar. Could longer PTT, slower to clot, impact implantation? Longer? Probably not. Can you use the elliptical after a transfer? You can use it. But again, I'm all for walking and for light swimming, light exercise, not heavy exercise, because your blood flow, you want it to go to the uterus, not to the muscles. What do you recommend immediately following FET? Bed rest or light exercise? Bed rest for 1 day and then light exercise. What's with all these exercise questions? It's really interesting. Yeah, all about exercise. Interesting. Doing IVF, what food to eat? Well, a low-carb diet, moderate protein, high good fats like guacamole, avocados, grass-fed beef, wild salmon. What is your recommendation for healthy eating prior for retrieval? God, it's like I have these feeds that are people asking the same thing. I just mentioned it. Does IVF? Oh, I already said that. What foods? So, folks who are just joining now, I'm about to end the Facebook Live, Instagram Live, YouTube Live. I go from 4 to 5 p.m. Mountain Time. So thank you for joining. But unfortunately, we're going to be stopping now. Let's see if there's anything else. Can you explain why you recommend fresh transfer for women with low ovarian reserve? Yes, simply because you get a transfer. Because it's low ovarian reserves, it means it may not grow to day 5 and you wouldn't get a transfer. All righty. So I want to thank you all. I think I've really got to spend some time on these anti-inflammatory questions you guys have, and I'm depending on my schedule, I might be able to get into something next week where we'll talk about some of the immune protocols, what the data supports. Anyway, I'm Dr. Magarelli, CNY Fertility Colorado. Thank you all for joining me today. It's been super. Remember, the body wants to be pregnant. Nature wants you to be pregnant. So please have faith. Avoid alcohol, tobacco, drugs, of course. Everybody should be vaccinated, please, regardless of what is out there, the politics. It just helps. Rest, good rest, keeping yourself hydrated. Acupuncture. If you don't have an acupuncturist, go to the website aborm.org, aborm.org. If you're coming to Colorado, contact eastwindsacupuncture.com. They'll happily try to get you in for the pre and post transfers and the acupuncture for fertility. I still promising to get Doctors King and Credenda online here. Maybe I'll do that pretty soon here. Well, anyway, thank you, folks, for letting me talk to you today. It is my pleasure. I wish you the best. Thank you for telling me that you're recognizing that I'm trying to be as transparent as I can with you guys. It's tough today to be transparent, but I want to give you this straight poop. It's what I would want. And really appreciate you guys. Yes, love the kisses. You guys be well. Take care. Bye-bye.